Thanks, Mr. Chairman. Thank you all for being here. And let me just say at the outset, to address this side of the room for a moment, gathered in this room at this moment in the United States Senate are the people, 11 or 12 people, who could literally make a difference for generations in medical research. As was noted by Senator Mikulski, we have both the authorizing committee and the appropriating committee in the Senate. If we took a stand, a bipartisan stand on medical research and said, come hell or high water, we are not going to tolerate a shutdown, a sequestration, a CR. We are going to increase the funding for NIH and related medical research agencies. We can make a difference. We can just make it clear. Don't try to get through the Senate if you're going to touch it. And I want to commend the chairman because I bothered him, begged him, and challenged him for a long, long time based on Dr. Collins' admonition to me. Give me 5% real growth for 10 years and I'll light up the scoreboard. And we've done it in this bill. I might add parenthetically at the expense of some other things and that are equally, or I should say important as well. But I want to commend the chairman for making this commitment for 7% growth at NIH, which includes 5% real growth at NIH. And as you've said, and was asked by Senator Shelby, a one-time infusion is a good thing, but constancy, predictability is what leads to researcher commitments and long-term success in what we achieve. I'd like to just throw out as a possibility that we rally around one particular person who's up here. For 28 years, Barbara Mikulski has been the strongest voice for the National Institutes of Health on Capitol Hill. And she's leaving soon, unfortunately for all of us, but I hope we can make a Mikulski promise that we are not going to forget the commitment of this budget and the commitment in years to come. And I will tell you this, in the time I've been in the Senate, you don't want to break a promise to Barbara Mikulski. It's something you'll hear about.
Well said.
So I hope we can be inspired by that. Let me try to bring this down to ground level if I can. I have two questions if I can get to them. The first is, when we talk about $2 billion in growth, $2 billion in growth in this coming year, I need to ask you, when it comes to areas like Alzheimer's, we know that we spent $226 billion on Alzheimer's treatment, just Medicare, Medicaid. We estimate that the private contribution of families is almost equal to that in value. So we are talking about 0.5% of what we are spending as a nation on Alzheimer's is the delta, the $2 billion that we're looking for here. And when it comes to brain research, we now have reached, I think, a point, and please confirm if I'm right, where we can start to visualize the development of Alzheimer's in the brain and know many years before the obvious onset that a person is moving in that direction. What do you see, Dr. Collins, or those who are with you, in terms of what we could do if we knew 15 years in advance that Alzheimer's was likely to occur? What could we look forward to do soon to delay it or, God willing, find a cure?
So I'm just showing you a picture that outlines the statistics. I didn't know you were going to ask the question, but you can see what the relative numbers are here in terms of what's currently being spent on Alzheimer's disease. This is 2013 numbers. Obviously, that number is now going up, and we wouldn't need it to. But comparing that to what we're spending, $203 billion in 2013, and an estimated $1.2 trillion in 2050 if nothing gets done. So this is a matter of great urgency, not just because of the economics, of course, but also the enormous human tragedies that are attached to this disease. Dr. Koroshetz, as a neurologist, director of the Neurology Institute, can tell you something about where we are on this and why we are optimistic that we can actually get to a place that doesn't result in that enormous blue arrow.
Yeah, thanks, Senator. I think you made a really interesting point that for the first time, we can actually see what is going on in the brain in people with Alzheimer's disease. So in the past, we knew it would happen when people died, but we really couldn't see that happening in the living people. But now we have markers, scanning markers for amyloid and tau, which are the major culprits in Alzheimer's disease, that we can see that in the brain now of living people. And as you said, the amyloid we can see developing years before the tau starts to hit in, and the tau seems to be the thing that kills the cell. So Alzheimer's is like the gun, tau is like the bullet. So if we can, the vision is that we develop a screening tool for people who are developing the amyloid, know that they're going to develop Alzheimer's, and then come in with a drug to block that process. And in actual fact, those drugs are currently being tested in clinical trials. So we could get lucky. I mean, this looks very, very promising at this point in time.
And let me add, because Secretary Ernest Moniz would hope that I would add, that this technology, which allows us to visualize, our Department of Energy and Office of Science had a lot to do with this. So when we talk about medical research, the technology side of this equation relies on other agencies. Do I have 10 seconds? Darn it. I'll try to be here for the second round.
I would like to just quickly say that that is a very good point, and we actually have a joint meeting about the brain between the Department of Energy and NIH coming up in 2 weeks in Chicago.